The Madagascar miracle drink? An anti-coronavirus tea made from the plant Artemisia annua. The Madagascan president says it works.
I'm convinced that history will prove us right. 2 people have been cured. I can't wait to see what it can do next.
The herbal ingredient of the drink is medically proven to be effective against malaria. Now it's being distributed for free on the island against COVID-19 and shipped on bulk to other African countries. Is traditional medicine the answer? It's what many Africans turn to when the next clinic is far away. But the World Health Organization is yet to prove the efficacy of the plant. Some doctors say untested herbal brews could be a risk rather than a remedy. As pharma giants around the world race to find a cure for the coronavirus, Madagascar says it already has one. But there's heated debate on social media. Africans accuse the West of being condescending towards their faith in traditional medicines. Ghanaians also say they have a remedy. DW's Isaac Kaletsi reports.
For more than 2 decades, Samuel Ajani Jima has been working as a herbalist. He says he turned to herbalism after his wife was cured of an ailment by one of his concoctions. Jima only works with local plants at this production facility close to Ghana's capital, Accra. He says they are preparing a remedy that can also treat COVID-19 patients. This drug can be used to treat coughs and malaria. Anyone who drinks it can also be cured of headaches. That remedy is not yet approved for use, but Jima has been producing it while awaiting approval from Ghana's Food and Drugs Authority. Herbal treatments are not uncommon in Ghana. At this health facility in Achimota, all patients are treated only with herbal remedies. Its owner also says his drugs can treat COVID-19.
When you see that people are dying as well and so forth, we don't feel well. And that is why we are now hopeful and happy that we've come out with a medication that can help the whole world to be able to fight this COVID-19.
Ghana's Food and Drugs Authority says 33 herbalists have submitted remedies for COVID-19 for drug approval. None of them has been approved for use.
There are a lot of speculations around. People are saying all sorts of things, but none of them is backed by scientific evidence. And FDA requires absolute sound scientific evidence to be able to register, give any product market authorization.
Ghana's Medical Association also advises against herbal remedies. But at markets, herbal medicines are being touted as a means of preventing and fighting COVID-19. And much to the delight of herbalists, many continue to believe that they work. And that is keeping people like Samuel Ajani Jima busy.
Niba Galini heads up the discipline of traditional medicine at the University of KwaZulu-Natal in Durban, South Africa, and is one of the leading experts in his field. How much faith do you personally put in traditional medicine, just in general?
A lot, because of its history. It has stood the test of times over many generations.
What do you think, though, about this herbal remedy from Madagascar? Is it going to stand the test of time?
I'm very positive, yet I still am keen that there is proper science that is undertaken to really answer a number of questions. Look, this corona is new, it's a new virus to us, so it's not, although you link it with tradition, but you still need to make sure that you do the best science that you can do.
OK, so we should look to science on this one, but in the meantime, what about all the people who are taking this? I mean, could it do more harm than good?
From our knowledge, this is not a plant that is toxic. the challenge with humanity is that under these conditions, you don't know whether people will overdose themselves out of anxiety. But under normal circumstances, it's not a plant that is known to have any toxicity to humans.
But it could give people a false sense of security, couldn't it?
Clearly, because we don't have evidence, it's just people are relying on traditional knowledge that this thing has been used in many years ago to fight colds and flus. That's the only thing I can say.
But what if people take it? They should still make sure they're social distancing, for example, that they still take precautions and don't let down their guard.
No, definitely. Look, there are two things here. The first is that even if you don't take any of this product, you maintain the normal hygiene of all the ways to prevent yourself from contracting the virus, as well as you spreading the virus, because it's both ways. So that is important, and hand washing and all the preventative measures that we know. It's a false thing to assume that there is a cure, and then people may take they might go off guard. Secondly, this is a traditional medicine. Under normal circumstances, they should be prescribed by your traditional healer who looks after you, even if you have side effects or other things that they must be looking after you. So it's not something that you just, prescribe for yourself.
Sure.
And also just administer to yourself with no one supervising what you are doing, even your medical doctor for that matter.
Tell me also, medicinal plants are not only used in Africa, also widespread across Asia. In Thailand, for example, they're used in modern hospitals. Are Western scientists looking for a cure in the wrong places?
No, there are many pharmaceutical drugs in the market today that emanate from medicinal plants. And that's now look, what the difference is that what the pharmaceutical industry is helpful is that you preserve the environment. You don't have to chop many plants. You don't have to destroy much of nature because you synthesize this chemically once you identify what is the active ingredient, and then manufacture it, and you can do it in bulk and ship it to many places. However, these pure compounds tend to have side effects, much more side effects than just the normal plants. So, these are the things you balance in the work that we do.
Niva Galini, we'll have to leave it there. One of the leading experts in the field of traditional African medicines. Thank you very much.
Thank you.
Now to our science correspondent, Derek Williams, with your questions.
I'm recovering and having trouble shaking the fever. How long are we contagious?
There have been several studies on this, and they came to somewhat different conclusions. According to the Centers for Disease Control in the US, viral RNA can sometimes still be detected in patients for weeks after they've come down with COVID-19. But that doesn't mean that you remain infectious for that long. For healthcare personnel returning to work, CDC recommendations say at least 10 days have to go by after symptoms first appear. And of those, the person has to have been fever-free for at least the final 3 days of those 10 days, without any help from fever-reducing medications. And their other symptoms have to have improved as well. Other sources recommend waiting at least 14 days after symptoms appear before leaving quarantine. If COVID-19 tests are available, 2 can also be administered at least 24 hours apart. And if both of them turn up negative, then that person is generally considered to be non-infectious.
Would injecting plasma from people who have already had COVID-19 into healthy older people keep them safe?
People who have had COVID-19 develop antibodies against it, and they end up in blood plasma, which can be donated. When injected into people who have an active infection, the plasma might help them recover. This type of therapy has been used for over 100 years to effectively treat a range of different infectious diseases. And in the current pandemic, thousands of patients have already received plasma transfusions from people who survived the disease. But could transfused antibodies also have a prophylactic effect, a preventive effect? If, say, someone from a high-risk group like the elderly were exposed, could plasma prevent them from getting the disease? We don't know yet. A long-term study led by researchers from Johns Hopkins University is looking into the idea, but it'll take a while to get the results. It's only slated to conclude at the end of 2022.
What happens if you just rinse your hands well with fresh, clean, running water?
Could you wash any virus off your hands with water alone? This question is actually a lot more complex than it appears at first glance. And to explain why the answer is no, I'd have to give a long lecture on how soap works and talk about the chemistry of what are known as surfactants. Since we don't have time for that, suffice it to say that you can think of SARS-CoV-2 as being sticky, so water alone won't do the trick. Soap basically makes any virus that's clinging to the skin on your hands or caught in its folds soluble in water, which has to happen for the virus to be washed away.